For the last 2.5 months that Western New Yorkers have been practicing social distancing, fears have been growing in the mental health and addiction fields.
Nobody knows what to do now.
Public health officials and advocates have become increasingly worried about the vulnerable population of people they work with, as they say social isolation is a contributing factor in the recent spike in overdose deaths.
They're following the rules, which we really appreciate that, of staying apart, but on the other side of it, we're losing people because of it.
Erie County's opioid program director, Cheryl Moore, says there have been presumably 85 fatal overdoses in the county through the first 4 months of the year. That's an 88% increase from the same time period last year. What's interesting is the overall number of calls to respond to overdoses has not gone up.
They are alone.
So no one is there to administer Narcan or call 911.
We're having overdoses and we're finding people too late. It's way too late. It is long after they have passed on.
COVID-19 has forced the state to put guidelines in place, limiting the number of people at inpatient treatment facilities. New admissions have halted and bed space has been cut in half, and people are being turned away from getting help. Reducing access to treatment can have fatal consequences. Avi Israel's son, Michael, became addicted to painkillers after having a surgery. And in 2011, he took his own life when he was turned away.
He made a phone call to try to get a bed, and we were told that there were no beds. So he went in the back bedroom and shot himself.
Michael was just 20 years old. Israel founded an organization. The mission is in its name, to save the Michaels of the world, to ensure people get help when they need it.
Everybody that calls here is my Michael. Everybody. And I wish that I could help everybody. But unfortunately, right now, we can't.
And that weighs on him heavily, especially as questions remain about what the future of treatment looks like.
There's a whole segment of society that is being forgotten and never really got good treatment before. And right now it's being kicked to the curb. It's actually not even being kicked to the curb. It's being kicked right into the sewer. And people are dying.
For Channel 2 News, I'm Allie Ingersoll with Investigative Post.